22 weeks pregnant, and something feels different now. Not just physically, but emotionally. You're no longer just imagining your baby, you're feeling them. Their movements are stronger, more intentional, almost like tiny conversations happening beneath your skin. But along with these magical moments, new changes are unfolding in your body, your emotions, and your daily life. Some exciting, some uncomfortable, and some you never saw coming. Stay with me till the end, because in this video, we're walking through everything you need to know about 22 weeks of pregnancy, the signs, the symptoms, what to expect, and the little moments that make this stage unforgettable. At 22 weeks, your baby is growing beautifully now, about the size of a papaya, roughly 11 inches long and weighing close to 1 pound. But this week isn't just about size, it's about function, awareness, and connection. What's happening? Stronger, more noticeable movements. Your baby's muscles are developing rapidly. Those tiny flutters? They're now turning into real kicks, rolls, and stretches. You may even begin to recognize patterns when your baby is awake, and when they're resting. Senses are awakening. Your baby can now feel touch. If you gently press your belly, your baby may respond by moving away, or even pushing back. Hearing becomes clearer. Your voice is now one of the most familiar sounds to your baby. Your heartbeat, your breathing, even your laughter, all forming a sense of comfort and security. Your baby's skin looks wrinkled for now because fat is still building underneath. But week by week, they're filling out. Sleep-wake cycles begin. Yes, your baby is already forming patterns. And here's the interesting part, they may be most active when you're trying to rest. Those midnight kicks? That's your baby saying, "I'm here, mama." At 22 weeks, your body is doing a delicate balancing act, supporting your growing baby while adjusting to rapid physical changes. And this is where new symptoms begin to show up more clearly. Stronger baby movements. By now, movements are no longer subtle. You may feel kicks, nudges, or even rhythmic patterns, especially after meals or when you lie down. This is one of the most reassuring signs your baby is doing well. Back pain and postural changes. As your belly grows, your center of gravity shifts. You may find yourself leaning back slightly without realizing it, putting pressure on your lower back. Support your back when sitting, and avoid standing for too long. Swelling, especially feet and ankles. By the end of the day, your feet might feel heavier, tighter, even slightly swollen. This is due to increased blood volume and fluid retention. But sudden or severe swelling? Always report it. Stretch marks becoming more visible. Those faint lines may now deepen into pink, red, or purple streaks across your belly, breasts, or thighs. They're not flaws, they're quiet marks of a body making space for life. Braxton Hicks contractions. You may feel your belly tighten suddenly, then relax. These are practice contractions, usually painless, irregular, and short. Heartburn and indigestion. Your growing uterus is now pushing upward, and digestion slows down due to hormones. You may feel burning in your chest, especially after eating. Increased vaginal discharge. A thin, milky discharge, known as leukorrhea, is completely normal. But if it changes color, smells strong, or causes itching, seek medical advice. Leg cramps, especially at night. You're resting, and suddenly, a sharp cramp wakes you up. This is common due to circulation changes and mineral imbalances. At 22 weeks, something deeper begins to happen, emotionally. This is the stage where pregnancy becomes real, not just in your body, but in your heart. You may start imagining your baby's face, thinking about names, wondering what kind of parent you'll be. And sometimes, with that love comes fear. Am I doing everything right? Will my baby be okay? These thoughts are normal. You're not just growing a baby, you're growing into a mother. By now, many of you would have completed your anatomy scan. But if not, this is still within the window. At this stage, baby's organs have been carefully examined. This is one of the most reassuring stages medically, where you begin to see your baby not just as a pregnancy, but as a tiny human being. At 22 weeks, your body needs support physically and emotionally. What to focus on? Nutrition, iron, calcium, protein. Hydration. Prevents cramps and swelling. Movement. Gentle walks improve circulation. Rest. Your body is working non-stop. Sleep position. Left side for better blood flow. While most symptoms are normal, there are a few signs that should never be ignored. Severe abdominal pain. Heavy bleeding. Sudden severe swelling. Persistent headaches or blurred vision. Noticeable decrease in baby movement. If you experience any of these, contact your healthcare provider immediately. At 22 weeks, your baby is no longer just a thought, or a scan, or a heartbeat on a monitor. Your baby is movement, presence, and connection. Those little kicks? They're reminders that you're never alone. You are 22 weeks pregnant, and you are doing something extraordinary. Every stretch, every ache, every emotion, it all tells a story of life growing inside you. So pause for a moment, place your hand on your belly, and feel it. That's your baby, your journey, your miracle. If this video helped you feel informed, reassured, or even just a little less alone, don't forget to like, share, and subscribe.